Morning, Nigeria. Thank you for joining us. I am Veronica Dan Ikroy.
And good morning, Nigeria. It's always a pleasure to have you join us. Welcome. The discussions are on the table and we're about to have them. I am Ria Abdul.
I love your energy, Ria. Good morning, everyone. Welcome. This is TVC Breakfast on Thursday. I am Nelson Etta.
So we have two energies now.
I know, and I love it. I'm loving it.
Nelson, it's good to have you here
Absolutely
again.
good to be here
after
at the table.
hiatus of how long now?
Well, you know, I went somewhere to have fun, and I came back looking refreshed and good.
He missed us.
Of course,
boy.
It will be interesting having you around for the next 2 weeks or less, whichever one, but good to have you.
I'm a good spice of the bro, so hey.
Of course, I get you. But of course, like we have rightly pointed out, we have an array of issues we'll be looking at this morning, definitely looking at how to address some concerning issues happening in Nigeria regarding flooding and every other thing that we need to talk about this morning. And of course, we'll look at the papers and then stories that are trending now. But let's begin with the story where Nigeria's First Lady, Oluremi Tinubu, is advocating a collaborative effort to eliminate cervical cancer in Nigeria. She made this appeal during the launch of a new partnership dedicated to eradicating cervical cancer across the nation. State House correspondent Femi Akonde has details.
Cervical cancer, the fourth most common cancer among women globally. This brings to the fore the need for urgent resource mobilization in Nigeria to combat its prevalence.
Together, we must invest in a future where no woman dies from a disease that is preventable.
At the launch of this partnership dedicated to eradicating cervical cancer in Nigeria, the First Lady, Senator Oluremi Tinubu, delivered a clear message, emphasizing the need to reduce the prevalence of the disease from the nation.
I am glad that this partnership aligns with the renewed hope agenda on health of His Excellency President Bola Ahmed Tinubu, GCFR, to promote the health and well-being of Nigerians, particularly eliminating cervical cancer as a public health threat for women across the nation.
The First Lady appealed to all stakeholders, calling for a unified effort to combat the disease.
We must build on this momentum and expand HPV screening, scale up treatment through innovative, cost-effective technologies and establish these services where they matter most.
The task force is an interventional committee and was given the mandate to work with the Nigerian Institute for Cancer Research and Treatment to coordinate efforts to eliminate cervical cancer in line with the National Strategic Plan 2023-2027. This assignment is crucial in operationalizing Nigeria's response in alignment with the World Health Organization's 90-70-90 target for cervical cancer elimination by the year 2030.
Stakeholders present here shared this sentiment, and they all committed to supporting the campaign to eliminate cervical cancer.
They continue to bring to public health advocacy. Their involvement will remain critical to the progress we seek. To everyone who has worked behind the scenes, we thank you. The Nigerian governance, under the chairmanship of His Excellency Abdurrahman Abdulrazak, the governor of Kwara State, will support, collaborate with you in your efforts to eliminate cervical cancer in Nigeria.
Through the Renewed Hope Initiative, RHI, we have committed 1 billion naira to this effort.
The Renewed Hope Initiative of the First Lady, Senator Oluremi Tinubu, also committed 1 billion naira to this effort.
All right, we must commend the First Lady for her effort towards addressing challenges that women and children face as a country. We have seen her address the gaps, talking about healthcare, and here we are seeing her addressing issues around cervical cancer and also donating 1 billion naira to the cause. This will definitely bridge the gaps that we have been facing, because Nigeria has a huge burden of women with cervical cancer, about 12,000, and it is reported that 8,000 of them die as a result, and maybe because of late detection, and also the matter of access to resources, healthcare, medicines, and all. There's the matter of HPV vaccine, which some persons do not even want to take. That one is another discussion on its own, but we are seeing efforts being made to bridge that gap of what we have been facing regarding cervical cancer.
Yeah, it's quite commendable that the First Lady has done this, and that 1 billion that she has donated, I think a good chunk of it should go for the education, educating the people on the dangers of cervical cancer and the need for the HPVs to be embraced instead of being repelling to the people. These are the kind of interventions that wives of leaders should champion, you know. And peculiar thing, her husband the other day subsidized was it dialysis, you know, and he has done a fantastic investment as far as health is concerned in Nigeria, and a lot of people hail him for appointing the minister for health. They say it's a square peg in a square hole. So when it comes to health care, this administration is doing well, and the First Lady is really being one of the reasons for the success.
Absolutely, I agree with you. Talking about vaccine, before I come to you, Ria, there's this matter of hesitancy, resistance, because of what a lot of people talk about when it comes to vaccines, taking vaccines. Recall COVID-19, a lot of people were hesitant and were scared. And there's also the matter of culture, tradition. So a lot of people try to avoid vaccination. So I agree with you on the matter of we need to do more on educating people on the need to take the vaccine. Right.
For me, I would think that I love the fact that she's taken center stage in, you know, taking leadership in women's health. It's beautiful to see that. And we've seen her do it with children, and now we see this happening. Cervical cancer is something that a lot of women even have, but they know nothing about. And that's why I agree on education. Some people do not even know. And some people die from it because of late detection. So I'm happy that she came out. This is a beautiful initiative. 1 billion is quite, it's money.
It's huge.
It's a lot of money. But I hope some of it will also go to educate these women, you know, to go for early detection. Because sometimes people have things in their body, it will kill you, not just because you didn't treat it early. So a lot of these women die because of this.
Because you do not understand the symptoms.
Or the symptoms, exactly. Yeah. And some of these women in the rural areas as well, let's not forget, they don't have education about it.
Access to healthcare is a major challenge. But Nelson, let me quickly come to you, still talking about the 1 billion. I recall that we saw some cut down on donations from foreign bodies, and so this 1 billion should go a long way.
Well, I'm glad that the First Lady is doing this, and like Thomas said, you know, apart from wives or first ladies of different states, as it were now, you know, I think government as a whole should throw their weight into this. She mentioned the rural community. It's a major challenge when you go, you know, to our rural communities across the country. And I have the privilege, especially traveling around the north, and there's a huge challenge of awareness and access to treatment. Access lies between resources and facilities. And so you go to a typical primary healthcare center, they literally have nothing in there.
Absolutely.
And so if this 1 billion naira will be judiciously shared among states, it should get down to the primary healthcare centers in the rural communities where we have most cases of cervical cancers, you know, in women. And so this is really important that the First Lady has done. Kudos to her.
So
we want to see
I believe that states will want to work hand in glove with her, because they are the closest to the people, and they know who are those that actually need this. I just want some transparency, and that this matter is devoid of corruption.
Exactly.
At the end of the day.
I'm really spotlighting on education. We need to educate these women in the rural areas.
But if the money is missing, how do you educate?
It will not miss. In Jesus' name, it will not miss.
All right,
has a lot to do.